All right. Well, hi, Gianina. Thanks for joining me.
Hi,
Hi.
happy to be here.
Yeah. And well, we're here today and meeting to chat about dance movement therapy because that's something that you practice.
Mm-hmm.
And I would love just to get us started, just to hear kind of what got you into it, what motivated you to specialize in that.
Sure. So my name's Gianina, and I am a licensed marriage and family therapist associate, and also a registered dance movement therapist.
Mhm.
I did my background at Antioch University, in which I focused and studied on both, and I integrate both into my work. But today's conversation is going to highlight the dance movement therapy piece, since I know that's something that not many people have heard about. So, what got me into it is dance movement therapy really integrated my passions with dance and embodiment practices, and this desire to support others in their healing journey.
Mhm.
So, through my personal experiences with being on the client end of receiving dance movement therapy, and also in the professional aspect of using this modality to support others, I found it to be very helpful. And that's, yeah, what bridged those passions for me.
Yeah. And so it sounds like because you used the word somatic.
Mm-hmm.
Um, and so it sounds like you found that that is a really helpful way to work in kind of a more somatic, body focused modality, along with kind of marriage and family and systems.
Yeah, so it's like blending somatic, which is using the body and movement as primary tools for healing. It's also blending in creativity. So it's bringing in the creative process and that emergent process. And then it's blending the systems work, which is very informed by the marriage and family therapy background. But dance movement therapy in its nature is also relational. So there's co-creation that happens. So there's like the therapeutic relationship is a big piece of what makes dance movement therapy more of this psychotherapeutic modality, as opposed to like going to take a dance class.
Okay. Which I want to get into of like, yeah, how does it differ from like a dance class?
Yeah.
Yeah.
So that's like one of the misconceptions around what dance movement therapy is. That it's a dance class, that it's teaching movement, that it's choreography, and that you have to know how to dance before you can engage in dance movement therapy sessions. And that's not true. You don't have to know how to dance. There's no requirement of having a dance background. And this differs from a dance class in that in a dance class, normally you're a student, there's an instructor, you're being taught movement, and there's this working towards a technique or a product. And dance movement therapy is more process oriented, and the focus isn't to achieve a movement, it's actually stepping back and moving in ways that are authentic, that come up naturally without judgment, and that express those deeper emotions and help to process those emotions. And it happens in the safe container of having a psychotherapist on the other side who is co-regulating you, who is in this therapeutic relationship with you to support you in while you access these deeper emotions, sensations, triggers, just things that are coming up in the body and need to be expressed. So that's kind of how it differs.
So here are a couple things of one, nobody has to know how to dance or is being taught to dance in
That's right.
dance movement therapy. And two, that things that are in the body or emotions
Mhm.
that people are holding can be expressed through this movement in a non-judgmental, creative space to release that.
Mm-hmm. Yeah, that's what is at the crux of dance movement therapy is we know, or there's an understanding that the mind and the body are not separate, and a lot of these memories, they live in our bodies. A lot of our emotions they're stored in our bodies. And
Mhm.
so the way it differs from like talk therapy is that um, it talk therapy can stay very much in the cognitive realm where we talk about how we're feeling and we understand it cognitively, and there's that piece to it. And there's in dance movement therapy, there's the piece about going deeper into more of that like mammalian brain, that the part of our brain that is um, tied to more of that primitive survival, um, yeah, the primitive or survival aspect of our human experience. And so when those things come up in the moment, knowing them logically, it sometimes we don't have access to that part of our brain that's the more logical side, which is in the prefrontal cortex, because that literally shuts off. And so that shuts off because we go into the survival state.
Mhm.
And so if we bypass working with our nervous system, working with that part of the brain to actually establish internal safety, and we just stay up here in moments where we might feel activated, we actually, our body can become our best friend to be able to regulate in those moments. And so it can really provide the sense of having a best friend. You can really ground
Mhm.
yourself when you feel flooded, when you feel overwhelmed, and your logic side of your brain has kind of gone offline.
Mhm. There was something you said that I absolutely love, like your body can be your best friend, and it sounds like a big part of DMT is really learning how to befriend your body and listen to your body
Yeah.
and build that relationship up. And so that sounds exciting, which because I feel like people need that.
Yeah, that's
So disconnected, and we live just disconnected. And what I hear from people is like I know certain things cognitively,
mhm.
but I still feel differently, or it's hard to be able to do something differently. And so to build that mind body connection and to be friends with the body.
Yeah,
Yeah.
absolutely.
Um, well, you've kind of talked a little bit about it, but kind of what would a typical session look like for people to expect when coming in?
So this is going to really depend on the person, because it can look really different depending on what age group I'm working with, what's developmentally appropriate. So if I'm working with children and their parents, I'm going to focus on emotion regulation. We're going to incorporate play. We're going to incorporate props. I'm going to validate their feelings. They're help them to just start to identify what it is that is going on in their body. And so a lot of the ways that we learn what is happening is through listening to the body and starting to pinpoint even the most basic understanding of what's my tummy doing when I get hungry, or what happens right before I need to use the restroom, or when I'm getting angry, what's going on, how do I feel, do I clench my jaw, do I my
Mhm.
hands go into a fist. And so dance movement theory for children can look like playing with puppets. It can look like mirroring, mimicking to formulate that attachment, not just between me and the client, but between the parent and the child. So teaching the parents as well, how do you use movement and mirroring, reflecting back with your own body, how your child is playing, how your child is moving, because that can help to strengthen that attachment, and it can really make someone feel seen and heard on a deeper level than words. because you are being seen and heard and empathized with on a kinesthetic level. And so it really takes that idea of entering a child's world even deeper, because it's now an embodied experience. So it can look like that. It can look like using instruments to redirect certain behaviors and really get that energy out. If, for example, there's frustration, we can hit on drums. And so we're alchemizing or transforming those like more difficult emotions that can feel really big, especially for children who don't yet have either the words or the skills to know what's happening and process those emotions. So we're using creativity in a developmentally appropriate way that supports them in processing what's happening in their bodies. And as well as working with the family systems to help them also do that work. With older populations, I really bring in the parts work, and it's more insight driven. The body has a lot of wisdom, and so it's paying attention to the body in addition to the brain. Sometimes I think that we want to stay up here in the brain because there's a certain certainty or control or disconnect from feeling the sensations that come up when we sit with our bodies. So with adults, it's learning how to build tolerance for sitting with the discomfort, the sensations, which are emotions, that is just energy and motion that's processed through the body. So how can we slowly start to expand that tolerance to sit with those things, and then even go even further as to explore if there's fears, if there's certain parts that have been repressed for a really long time because they're really uncomfortable to feel those. How can we start giving those parts a voice so that they can be expressed, be accepted, be understood? Where do they come from? What do they need? And that kind of thing. So it's a lot more like insight. We're going to use movement. We're going to use going into the body to go into those deeper layers. And we're also going to verbally reflect to start connecting the dots.
Yeah. Well, it just makes me think of, for adults when they come in and they're like, I'm experiencing emotion and I don't know how to make sense to it. I don't have words for it. It makes me think of just developmental trauma, that a lot of times those emotions and experiences are tied to memories that you might not even remember from the, perinatal into the first 3 years of life.
Yeah.
and beyond. And we don't know how to make sense of those experiences. Sometimes those experiences and memories are fragmented. There's not words, and we need something else to move through that, to process that in that more somatic way. And it sounds like DMT really does that.
Yeah, and it's also fun to play as an adult as well and to create. And I think that's a big piece of DMT, is that the playing and the creativity is not just for the children. We as adults also get to do that. And sometimes having that creates a little more accessibility to being able to access those difficult emotions. Because it's another entry point. And when we're playing and we're creating, it's almost like it kind of externalizes it a little bit. It creates a little more space to where you don't over-identify with it, and you can start to relate with it in a different way. In this playful way that uses your imagination, uses metaphor, uses movement, uses creativity.
Yeah, it makes me even think about my own work in using IFS or parts work, that a lot of times what shows up is a part that's like around 3, 4, 5 years old. And that part needs somebody to play with them, or couldn't play, or somehow something was getting in the way. And part of that process is, okay, well, how do we interact with that part and play and be creative and meet that part where they're at too, developmentally. So Well, we're kind of talking a little bit about developmental trauma. So one, it sounds like it's very helpful for developmental trauma with adults, but what other things would you say that it really helps with, that when you hear people are struggling or kids are struggling with X, Y, and Z, like this is really helpful?
Yeah. So I think DMT can work across the lifespan and for a variety of presenting concerns, because it is about building that relationship of love and self-compassion with yourself, which then automatically trickles out to how you relate with others. So I think it's good for people who want to build that, who want to um, change the ways they're relating with themselves and with others, as in like a more general way. But then if I wanted to get even more specific, I would say that it's good for, or something that I often hear and I see, is that some people have been in talk therapy for years and they have processed it cognitively and they understand, but there's a disconnect with translating that to their body and their behavior. And so I've heard that a lot, where it's like I've talked about this, I keep talking about this, but I'm stuck.
Mm-hmm.
And I think it's good for people who are experiencing that. I also think it can be good for people who experience anxiety, depression, trauma, um, neurodivergence. It tends to be effective with kids, especially, well, with the whole lifespan with neurodiversity, because it's an approach that is, it, if it can really meet you where you're at. It can really start to have you listen to what you need and how do you accommodate what you need, as far as like sensory things, as far as in general what your needs are. So I think it can be really good in supporting children with that, also with emotion regulation, with behavioral challenges,
Mm-hmm.
and a variety of things, because at the end of the day, I think what it does is it does help you to accept more parts of yourself and be able to be more of who you are.
A more integrated self, and
Mhm.
especially as an adult, and it sounds like even as kids, right? The neurodivergency and um, emotion regulation piece, behavioral piece,
Mhm.
uh, that DMT can be really helpful with, along
Mhm.
with, yeah, kind of, you know, all kinds of other various things that somebody would want help with. And confidence, I would think self-confidence, right? Like
Mhm.
being more integrated as well.
Yeah, yeah,
Mhm.
definitely.
Um, any other particular health benefits or anything like that that you see tied to DMT?
Um, well, I think that, yeah, I mean, there's different types of health benefits. Movement in and of itself, there's a lot of like physical health benefits
Mhm.
that come along with movement, just as you would see health benefits if you went for a walk, or if you went for a run, or if you did yoga and stretched. So
Mhm.
there's a lot of benefits that are in line with what exercise might give you. Although, again, it's not a workout class. It's not the same in the goal behind it. But if your body is needing to jump for 5 minutes straight, we're going to hold space for that. And
Mhm.
so the benefits can really vary depending on what's actually happening in the space. But as far as like the mental health benefits, there's many health benefits to understanding who you are more, to having that integration of self, to having that internal safety, to feeling that you have tools in your bag, that whenever you are needing that support for regulation, that you have access to
Mhm.
healthy tools that you can pull from, and that you don't need to go somewhere and find that externally, but that you have that in you already. So that empowerment piece.
Yeah, stepping into that, empowerment, confidence in self. And so I guess with that said, like for somebody who might be hesitant about DMT or questioning, oh, would this be the right fit for me, or why would I do this? Kind of any advice or things you'd like to tell them?
I say, if you want to build a better relationship with your body, yourself, and others, this is for you.
Mm-hmm.
And I would say, if you have hesitations and if you have um, that, if you're facing that resistance of going into a process that incorporates the body, that's totally normal. That's a part of the process, actually, and that's welcome too.
Yeah.
And that's what we work with. We work with that resistance, because when you have been stuck in your head for a long time, overthinking or uh, intellectualizing your emotions,
Mm-hmm.
of course, a process that invites the body in is going to feel scary,
Yeah.
because who would want to, like, that? There's a reason that's been there, right? Protecting you from feeling all of these things that can come up. Um, and that's totally normal, and that makes sense. And so I want to say to those people that this process is a slow process
Mm-hmm.
that really honors your pace, and that really centers the client, and the safety is a big piece, and that you're not alone in the process. And that's the importance of having a professional to hold that space, because we will go at a pace that feels right for you,
Mm-hmm.
and will help you as those uncomfortable things come up.
Mm-hmm. So I guess it sounds like, kind of even taking that in, it's like, okay, so it doesn't sound like if I, sign up to meet with you that you're going to have me do all these crazy things that I'm really don't want to do and find absolutely ridiculous. Like,
Mhm.
yeah.
Yeah, and if yes, so I'm going to meet you where you're at, and we're going to the therapeutic goals are going to be what you're coming in for. They're not going to be what I
Yeah.
would like. So at the end of the day, this is a modality that is still within a therapeutic space to help you reach your goals. This is just another way to do that. And so, yes, I'm going to listen to you. And yes, we're going to go at your own pace.
Mhm.
And if something feels silly, we're going to laugh at it, and we're going to explore what that is. So there's that piece to it as well. There's a piece about the dance therapist brings in also like what their own body's doing. So for me, I'm going to model and be right there with you doing these things. I'm not going to sit back and expect you to do something that I haven't done myself or am willing to do with you. And so, and I think it's also important that you're always in control of doing what feels good to you. You have that agency, and you consent to how you show up in a space. And I would never ask you to do something that you're not comfortable with doing, as far as that goes. It
Mhm.
doesn't mean that emotions are not going to feel uncomfortable, but it means that you are in charge of how you show up, and what you're okay
Mhm.
with doing.
Yeah,
Yeah.
it makes a lot of sense. And what would you say necessarily to like parents who are like, oh, is this for my kid? I'm not sure. Kind of what would you want to say to them as a
I
parent?
would say your kid's already moving. I would say it's like play in that way. It's their language. They're already doing it, and this can be a way to understand and really support them in and speak their language.
Great. Yeah. I mean, that is true, right? And I'm sure they're like, yeah, they're everywhere. Those kids. Yeah. Yeah. Um, and well, is there anything else about DMT or the work that you do that you'd like to share? I know we talked a lot about a lot of things today.
Just the importance of seeking out someone who, if you're seeking for dance movement therapy, specifically seeking out someone who is either a registered dance movement therapist or a board certified dance movement therapist, um, because that just is, it's a training and there's a lot of that goes into it. And so um, to have that, to look out for those things if you're looking for dance movement therapy specifically.
Mhm.
And then for people who are curious about dance movement therapy as in the facilitator side of it, um, or even something else that is also an embodiment practice using the body and movement through their own work, I would just say to do the embodiment work first, because that's something that I am actively currently doing in an ongoing way. And it is really important to be able to do that embodiment work for yourself,
Mhm.
so that you can support clients in their embodiment process.
Yeah, absolutely. That makes a lot of sense. And well, so, you know, if people are interested in trying DMT, like how would they schedule with you and things like that?
So you can go to our website. You can go to North Star, and Sherry, you can help me with this, but it's northstarcw.com.
.com. Yeah.
And there's a whole page on dance movement therapy there. You can read more about it. There's also some really good resources for learning more. The ADTA, which is the American Dance Therapy Association, is really a good place to go to learn more. They have some really great YouTube channels as well, where um, you can see how dance movement therapy can be applied for different types of things that you might be struggling with. And you can get even more insight into a lot of the dance movement therapists that are in the field, the kind of work that they're doing, and have their perspective on how they view this work as well.
Great. And so those are some resources. And I believe that even on the North Star website, that you're available for a 15-minute free consultation if people just want to meet with you and see if it's a good fit too.
Yeah, please reach out if you're looking for this. I'm happy to meet with you. You can call our office and get scheduled for a complimentary 15-minute
Mm-hmm.
consultation in which we can just talk, see if we're a good fit, see what you're needing support with, and I can explain more, answer any questions if there are any around the type of work that I do.
Great. Well, thank you, Gianina,
Thank
for
you.
chatting with me today and sharing about dance movement therapy.
Of course.
It sounds like such good work. So, yeah.
Yay, I'm excited. And thank you, everyone who took the time to watch this. And I hope to meet soon.
All right.